Right, so this is going to be this is a presentation about how we've heard about the clinics and how great they are, but this is about what living with a rare and complex condition's like in real life at home on a day-to-day basis. So this is my son Keon, who's now 12. But a bit of background information about Keon. Normal delivery, great pregnancy, absolutely fine. At 3 weeks, Keon collapsed in heart failure. And we were told at that time that it was thought to be some kind of virus that had entered his heart, but gave no other reason really for that. He then thankfully recovered and returned home, but collapsed again at 4 months old. At this time, he was diagnosed with dilated cardiomyopathy, and we were told that the only chance of survival really would be a heart transplant. So, very difficult time for us, but he did start to recover and he amazed everyone. And now his heart's doing really well and looks more or less normal. And his cardiologist in Leeds is amazed, really, looking at the state his heart was in as a baby. Can't believe it's recovered to the extent it has. Although, with the nature of Alström syndrome, we know that he will continue to be at risk. Then at 6 months old, Keon was diagnosed with cone dystrophy and was registered partially sighted at that time. We noticed a nystagmus, which was a wobbling of his eyes. At that time, he wasn't that sensitive to light, but then that soon became had a real big impact on his life and does now on a day-to-day basis. He has to wear a peaked cap, he has to wear his dark glasses all the time, and he's really sensitive to light. As 2 major organs had been affected within that first year of life, it prompted a referral to the genetics department, who then suggested there was a possibility of 2 conditions, Alström syndrome being one of them. The other one was a mitochondrial condition. So I went away and did the research on the internet, as you do, and frightened myself to death. So that I did think he fit the Alström condition. So I then contacted ASUK. In that time, we had numerous admissions to hospital that year with persistent chest infections and pneumonia. But his heart remained well, even though he'd been that ill. Even though he was seriously ill, his heart stayed strong. So it was about 12 to 18 months when we found ASUK. And even though I was seeing a geneticist in Sheffield, they actually did we were seen by Birmingham Children's Hospital, and we did eventually get a diagnosis of Alström syndrome. Now, that diagnosis was a mixture of feelings for us as a family. Relief that we'd got a diagnosis and we finally knew what it was we were dealing with. Devastation because of the extent of the condition and what we learned could possibly happen to Keon in the future. He then, he was breastfed up until being about 15 months and his weight didn't seem to be a problem. As soon as I stopped breastfeeding, he piled the weight on and he became really overweight. We didn't actually get a firm diagnosis of Alström until he was about 2.5, 3. So between that time, I was feeding him like everybody told me to, high-fat diet for a baby and, plenty of milk and cheese and things like that. And I thought I was providing him with a healthy, balanced diet. But as soon as we found out about the diagnosis of the condition and we had access to a geneticist, I was able to reduce his calorie intake. He's always been overweight, but his weight is well managed now. And we fight that on a daily basis. And it's really frustrating for him to have to be restricted in that way with food. He's now registered blind and has been since the age of about 3, although he's still got some useful vision. He's got a mild to moderate hearing loss. He's got scoliosis, which is a curvature of his spine. He's under a chest specialist for his recurring chest infections, although he's, from a chest point of view, he's quite well now. And he sees a physiotherapist and occupational therapist. So the impact of living with all that, it's really, as I said earlier, the need for multidisciplinary care has made a vital difference to us, and it's the frustration I have, the number of different specialists we'd see and the amount of times I had to go over and over his condition, and which wasn't so bad as when he was young, but when he were coming to terms with his condition and learning more about it, and at an age when he could understand what I was talking about, having to say that over and over again was very frightening for a young person. Dual sensory loss. We have a fantastic visual impairment team in Rotherham who've got a good understanding of visual impairment, but not everybody else out there in society has. And it's a unique disability in itself. Dual sensory loss. It's the visual impairment and the hearing impairment. There's a lack of understanding out there about dual sensory loss. Again, the constant requirement to manage diet, exercise and drug regimes. The diet's been an issue for Keon in school. He could never understand why he ate far less than his peers, yet he was the one that was overweight in his class. And even now, we have to go on to talk about autistic traits. You know, routine is so important to Keon, but where food's concerned, we found if he has breakfast and he has lunch and he has dinner and a piece of fruit when he comes home from school, that's how we've been able to manage his diet. He can't cope with choice. And when we come away to places like this, he loves it because he has treats like any other child does. It's really difficult for him to try and control that, and he gets quite anxious around food. Direct payments have made a big difference to our life, so we had to fight for that. But social care now provide a personal assistant for Keon because I work full time, and they'll come for 2 hours, 4 nights a week after school to take Keon out and about to do whatever he wants to do, and that's about keeping him active and letting him access the community. But it is the main reason for getting direct payments that I fought for was to do with his diet. The autistic traits have been a real difficult thing for us to manage since Keon was a baby. He has got some very obsessive behaviours, and I did go we did go to see if he may have autism, and we did see a specialist, and they did an assessment, and the outcome of that was that he did have strong autistic traits but not enough for a diagnosis. Now, I know that there is similarities with people with a sensory impairment, you know, the need for routine, and I understand all that, but I always felt that it was a little bit more. So yeah, it's a complex and progressive disease. We've had to come to terms with that. And Keon himself is having to come to terms with that, which is the most difficult thing. He made a comment to me a while ago, you know, what kind of life am I going to have not being able to see? And, you know, and the questions as a parent, trying to answer questions like that is very difficult, but you have to, I think my way of dealing with it is trying to be sensitive, but being honest and not giving him any false hope, but trying to show him that there are positive role models out there and just trying to support him through that. Very little knowledge and awareness of Ahlstrom in every area of our life, everybody we come across. Education has been a real difficult battle for us. Keon's been in a mainstream school all of his life, and he's now just gone into mainstream secondary school. So that's been a big change in our life, and it was a very difficult decision to make as to should he go into a mainstream school or should we look at specialist provision. Some of our young people have done wonderful, and we've got one young man in the room today, Liam, who's done absolutely outstanding at college, in a college for young people with a visual impairment. For me as a mum, I found it really difficult, the thoughts of sending Keon to a residential school. And that's my anxieties, and but that was our choice as a family, is to keep him in a local school. Another battle has been whether to teach Braille or not, because we know because it's a progressive disease, the chances are that Keon will lose his vision at some point. And again, Liam and his family have often said to me about the importance of Braille, and so have a lot of other people. When Keon started in education, the visual impairment team understood about the condition, but didn't, and we discussed Braille, and they felt it would be too much to introduce it at that time. What I'm finding now is at 12, as I'm trying to introduce Braille and to talk about Braille, Keon's not having any of that. He can touch type and he can still use print, and all I get from Keon is Braille is for blind people. And although he knows he's got a severe visual impairment, and that is one of the things I'm coming across. I've been to America recently to an international conference for Ahlstrom, and that is so common with some of our other young people, and that is a regret I've got, and I do feel I let Keon down by not insisting that he was introduced to Braille at a young age, but I didn't know any better then. Isolation is one of the big things Keon faces in mainstream school. Through primary school, he had one best friend, and the friend he had got autism himself and had got his own needs, and for reasons of the other young person, that relationship broke down towards the end of school. So now I can't really say that Keon's got a friend, which is devastating for me as a mum. For Keon, he seems to breeze, and and he just keeps saying, I don't need friends, I'd rather be with grown-ups, and he likes adult company. But I just think I'm sure he would thrive on having some friends in school, and if he was in a different setting, maybe those friendships would flourish. I don't know. It's been very difficult to share the information about this condition with other family members. Obviously, you don't want to upset family members when you explain all this, but also around issues around food, trying not to get Nanan to give him a biscuit when he goes to visit, but they want to. It's, oh, poor Keon, he can't see that well, he can't hear that well, let's give him a piece of chocolate cake, and that really doesn't help. And I think for some of our Asian families as well that I've found with the families that I work with, trying to explain that this is an autosomal recessive condition, it's a genetic condition. Both parents have to carry the gene to have a child affected by the condition. Any family will say to you, but there's nobody else in my family that's got this condition, so it can't be genetic. So yeah, trying to support families to get that message across as well. So our being a carer has impacted on my life, changed my life completely for the better. But it's been a difficult road. I had to resign from work. I worked in I managed pubs at that time, so I had to move out of there. I had to live in a council property. I had to rely on benefits. My relationship broke down. I then wanted to go back to studying, but because I was on carers allowance, I couldn't study full time. Otherwise, they'd take the allowance off me. I got a new partner, and so then I was able to go back to work. We made the decision to have a reduction in income so that I could go back to work and look at the bigger picture. I then had another child, which has been wonderful, and he's fantastic, but it was so scary. And even though it was a different partner and I knew the chances of having another child with Alstrom would be greatly reduced, it still scared the hell out of me. And I was the worst pregnant woman in the world. I needed every test and every scan and everything going just to reassure me. I've battled every area of health, education, social care and benefits, and still am doing. I've got a case for disability living allowance that's just gone to High Court, and we're just waiting for the final stage of that. And I think one of the big things for me is a feeling of guilt because I want to work. I've got a child with extremely complex needs, but I still feel as a person in my own right that I want to work, and that's tough. Keon would much prefer me being at home, but I need to go out there and work. I'm Keon's care manager and trying to coordinate everything. Even though we've got this fantastic service in Birmingham, we don't live in Birmingham, we live in Rotherham, and I still have to coordinate everything there. Keon's very dependent on me, but as I say, with the introduction of direct payments, it's made such a massive difference to our life. Both my children are my world, and I love them both equally. They're both very different and got very different qualities that I absolutely adore them both for, but they both can be little monsters as well. The reason I got to work with Alstrom is everybody deals with things differently. My way of dealing with living with this condition is I wanted to know the ins and outs of it, learn everything about it, and I live and breathe this condition. Some people say that's not healthy and maybe I'll not be able to carry on doing it forever, but I absolutely love my job and I do it because I'm so passionate about it. And everything that I've gone through as a parent, it infuriates me that parents are still going through that nowadays. And what I want to do is to try and support them through that and just take that pressure off, because it is different when you're advocating on behalf of another family. It's different to when you're actually going through it yourself. The best part of my job is working with young people and families, and Liam has been a great inspiration to me and my family and to Keon himself. Keon's supporting us now to develop a new transition plan. So we've got a transition coordinator at Birmingham Children's Hospital, and he's developed an information sheet that he's been through the adult system now, and they have very different tests and experience to what you do in a children's clinic. And Liam's developed an information leaflet that's helping to prepare our young people moving from children's to adulthood. And I don't think anybody can prepare another young person any better than a young person that's just gone through it themselves. And, that's been fantastic, and we've had some wonderful feedback on that. The development of the Asian mentoring scheme is been one of the things I'm most proud of as part of my job. We've got some wonderful families, and we're managing to find children much younger, and hopefully they're then getting the care and the support from the children's clinics and getting all the tests and the management of their health. And we've actually gone out there and found them. So yeah, we're very proud of that. But fantastic families, and I also support families through bereavement, which is difficult, but that's part of the job, and I wouldn't want to do anything different. That's part of my role, and I do get a lot out of supporting families and seeing them and supporting them through that phase, which is very difficult, but we've got some really strong families. So acknowledgements. First of all, to acknowledge Keon for being such a wonderful son and an inspiration to everyone around him. My family have always been supportive of me. Even though I was a single parent, my mother was there for me throughout and still is now, even though I'm married. Lee's General Infirmary for saving Keon's life in the first place, and Rotherham. And all the professionals working together to support Keon. Crossroads, again, is the people offering direct payments. Kay Parkinson, who is the founder of ASUK, I don't know where I would have been without that woman. The support of the charity made such a big difference to our life. And that's what we're hoping to, that's what I want to give now to other families. And to Professor Barrett and Dr. Richard Paisley for instigating these clinics in the first place. And this is my family, and I do feel we've got hope for the future with these clinics, with the support of ASUK, with the new research that we've got involved, and also joining together as a Ciliopathy Alliance. We may be different conditions, but we've got things in common, and I do feel that any future research may benefit all of our conditions in one way or another. Thank you.
I just wanted to ask you, go back to Keon's schooling again, and I appreciate as a parent the difficult choice between mainstream school and specialist school, and I think probably I'd also want to keep in mainstream school. Do you, as a parent and as someone associated with Ulster UK, do you think we need to do more in schools?
What's been really good is from ASUK point of view, I go into schools for our other young people and take part in their annual reviews and make sure they're aware of the condition. So then that made me think I should be able to do that for my own son, if I can do it for everybody else's. But I'm viewed differently as a parent than I am as a representative of ASUK. So our transition coordinator, because our transition phase at the children starts from 11. As soon as a child enters secondary school, that's when they come under the transition coordinator. So she's contacted Keon's school recently and is giving them suggestions of how they can improve things for Keon. And it's not about Keon fitting into mainstream society and fitting into, daily life in a mainstream school. It's about the rest of the pupils in that school actually adapting and making sure it is accessible and inclusive for Keon. We talk about inclusion. Inclusion for a lot of our young people is exclusion because they're often sat outside a classroom doing work on a one-to-one basis. So.
That's something what I found in the literature when I was trawling the literature, and some of the patient notes go back 10, 15 years. So this is not new. This is a theme that's carrying on, and I just feel it's really important that we look at different ways of how we can solve this.
Sorry, just touching on what you're talking about education. I'm a teacher of the deaf, and I was wondering whether there was like a specialist unit or something like, because I work in a mainstream school with a deaf unit. In your experience, children with complex needs, especially if they've got visual loss and hearing loss and maybe learning difficulties, is there an ideal place or what are some of the options? From an educational perspective, in what you've seen?
I don't think there is one ideal for all. I think for me, if New College Worcester, which is a college for children with visual impairment, was in Rotherham, Keon would definitely go there. And I think Liam and his family would tell you that the ideal place for Liam has been New College Worcester. He's thrived there and it's been brilliant. But I don't think it would work for all of our young people. We've got some young people who have got developmental delay, and they need a specialist setting. It may not be a school for visual impairment, but it's a special school, and they thrive in that school because they meet all of their individual needs. So I think what's really important with all of these conditions is, we've got a name for Alström syndrome, and it's rare and it's progressive, but everybody's affected differently at different levels. So I don't think it's a one size fits all. I think it's what fits that young person and their family.